Welcome to the University of Tennessee Medical Center Joint Replacement class. My name is April Humphrey. I'm the Clinical Director at the Advanced Orthopedics Center here at UT. Today, I'm going to be talking to you about your hip and knee replacement surgery. Our goal for the Joint Replacement Center class is to help you prepare for surgery. We want to give you an overview of your hospital stay, help plan for your recovery, ease any anxieties that you may be experiencing, and answer any questions that you may have. The mission of our program at the University of Tennessee Medical Center is to provide a joint replacement destination center that guides patients through a superior patient experience and long-term functional success through safe, quality, and patient-centered care. What that means is we want you to have the best experience possible. We also want to make sure that the care that we give you is safe and high quality, and we have your best interest at the heart of everything that we do. Our philosophy is education, wellness-oriented approach, early mobility, patient-centered care, and independence. That is the foundation of our program. We want to make sure that we give you the education so that you can prepare for your surgery and have a great outcome. We want to make sure that we are getting you up and we are moving you earlier and getting you back to independence as quick as possible. Our objectives: continually improve patient safety using clinical care guidelines. What that means, we use our clinical care guidelines that are evidence-based, meaning that these things that we do here are researched all throughout the nation to make sure that we give you the highest quality care possible. Now remember, your joint is sick, but you are not. If you've ever been in the hospital before, this hospital stay might be a little bit different than what you have experienced previously. We like to get you up, we like to get you moving, and we like to get you home so that you can be on your way to a quick recovery. Now we're going to talk about ways that you can prepare for your surgery. First, we're going to focus on your home. You will want to have someone to stay with you the first week after surgery. You're not going to be up moving around like you are right now, so it'll be nice to have an extra set of hands that are able to help you. You will want to make a path wide enough in your home for a walker. Think about things that you do every day, such as going to bed, going to the bathroom, or going to the kitchen. Make sure that you've got a path wide enough for you to walk through those areas with a walker. You will want to remove any obstacles that may cause you to trip. Think about rugs, cords, and pets. You will want to make sure that your paths are not only clear, but that they are trip-free so that you don't fall while you're trying to get up to do the things that you need to do. You also need to pick an area in your home that will be safe for you to rest and sleep. We also encourage you to have ice packs ready. You can go to your local pharmacy and buy ice packs, or you can grab a bag of frozen peas the next time you're at the grocery store. On the next slide, we are going to talk about some assistive equipment that you may need. Here's an example of some of the assistive equipment that you may need after surgery. You can purchase these items prior to your surgery at your local pharmacy. These things would include shower chairs, tub transfer benches, elevated toilet seats, and bedside commodes. If you have questions about what you might need after your surgery, feel free to give your joint patient navigator a phone call. In your book, you will find a list of exercises that you can do before surgery. We call these your preoperative exercises. These exercises are important to do so that you can build up your strength before you have your joint replacement surgery. If you have questions about your preoperative exercises, please do not hesitate to give us a call. Now remember, if you're doing these exercises and they cause you an extreme amount of pain, please do not continue to do them. What else do you need to think about while you're preparing for surgery? Driving. You will not be driving after surgery until you are given permission by your surgeon. You need to think about somebody who might be able to help you run errands after surgery and also who will be able to help get you to your physical therapy appointments. Home medications. Make sure that you get refills on your home medications before you come to the hospital. You don't need to bring those to the hospital with you, but it will be nice to have them at home so that you don't run out. Meal planning. Make meals ahead of time and freeze them. Whenever you go to the grocery store, pick out your staples. Think about protein, leafy green vegetables, and fruit. Make sure that you're drinking 8 8-ounce glasses of water a day. One of the things that our patients go through to prepare for surgery is a medical clearance. All patients must be cleared by PAT or pre-anesthesia testing before their surgery. In PAT, you can expect that they will go over a medical history with you. They will also tell you what medications you need to stop taking before surgery and any other testing that needs to be completed. I want to talk about some things that we do before surgery that help prevent infection. Using an alcohol-containing antiseptic agent for pre-operative skin clearance, this will be done whenever you come to the hospital before you go to the operating room. Cleansing with chlorhexidine gluconate or CHG soap 3 times prior to surgery. We will talk about this soap in the next slide. We also give you antibiotics before, during, and after surgery, and all of our patients receive a nasal antiseptic 3M product in the pre-op area. So let's talk about Staph aureus. Staph aureus is a bacteria that is commonly found on the skin and in the nose. 25 to 30% of the population are carriers, and less than 2% are colonized with MRSA. You will receive a 3M nasal antiseptic in pre-op prior to surgery unless you have an iodine allergy. Note, this can cause the skin around your nose to have an orange tint to it. The reason that we use this 3M nasal antiseptic product is to decrease the growth or colonization of Staph aureus. This can help prevent infections after surgery. Now let's talk about your CHG soap. You should have already received your CHG soap, but if you have not, please call the Advanced Orthopedic Center offices so that we can get that to you. We want all of our patients to bathe with the CHG soap 3 times before surgery. You will start using this soap 2 nights before surgery and then use it again the morning of surgery. How you are going to use that, we ask that you take a shower as normal, so wash your hair and wash your body using your regular shampoo and soap and then rinse off. Turn off the shower or step away from the flowing water and apply the CHG soap to a washcloth. You're then going to put that washcloth on your entire body from your neck down. Make sure that you do not put it in your genital area or anywhere on your face. You want to make sure to scrub your surgical area with CHG soap for an extra 3 minutes. Rinse off the soap with warm water, and then you're going to dry off and dress in clean clothes. Make sure that you change into clean clothes every night before bed. You will want to seek immediate medical attention if you develop wheezing or difficulty breathing, swelling of the face, hives, or a severe rash from the CHG soap. If you've ever had a reaction to the CHG, do not use this soap. Instead, just use an antibacterial soap. While we're talking about infection prevention, I would like to go ahead and talk about some things that you can do after surgery to help prevent infection. Make sure you wash your hands before and after changing your dressing. If you sing the happy birthday song, that should be about 20 seconds, and that will help get your hands clean. Do not let your pets sit on your bandage or your incision. Make sure to place clean sheets on your bed before you come to the hospital, and make sure you keep your sheets clean often. We also encourage you not to allow your pets to sleep in the bed with you. You will want to use a clean towel and washcloth after each shower or sponge bath. Make sure you put on clean clothes, and make sure that you keep your incision clean and dry. Here are a list of things that we ask that you do not do before surgery. Make sure that you do not take your blood thinner for at least 7 days before surgery. At your PAT appointment, they should discuss with you when your blood thinner medication should be stopped. Do not shave your legs 5 days prior to surgery. It's okay to shave your face and your arms using a brand new razor each time. The reason that we ask that you do not shave your legs is because the razors can create small cuts in your skin, which could make you more likely to have an infection. Do not wear lotion, powder, or deodorant the day of surgery. What do you need to bring to the hospital? We ask that you remember that you are only going to be in the hospital for 1 night. So make sure that you pack comfortable, loose clothing. You will also want to bring shoes with closed heels. Any toiletries that you may need that are brand specific, you can bring those as well. We have your common toiletries here, but if you like a specific brand, we encourage you to bring that with you. We also encourage you to bring your CPAP if you have one at home. Make sure that you write down the settings for your CPAP, and keep in mind that you will now be required to sign a form saying it's safe to use your CPAP while in the hospital. We also ask that you bring your joint replacement guidebook with you when you come. Here are some things that you will need to do the night before surgery. Make sure that you get a good night's rest. Take your nightly medications that you are instructed to take by pre-anesthesia testing or PAT. Make sure that you eat a good supper. We're going to talk about the fasting instructions on the next slide. You will also want to make sure that you take a shower with your CHG soap. We now have new instructions for when you should stop eating and drinking before surgery. Prior to these instructions, you may have always heard, do not eat or drink anything after midnight. I'm happy to tell you that we have changed that a little bit. You may now eat up until 8 hours before your requested arrival time. We ask that you avoid large meals or foods that are high in fat. You may also have clear liquids up until 2 hours before your arrival time. Here is an example of some of the clear liquids that you may have up to 2 hours before your requested arrival time. You may drink water, fruit juices without pulp, that includes apple juice, grape juice, and cranberry juice. You may have carbonated beverages. You can drink clear tea and black coffee, but do not put cream or sugar in your coffee. And you may also drink Powerade or Gatorade. Here are the things that you will need to do the morning of surgery. Make sure that you wake up and take a shower with your CHG soap. I know that some of you have an early requested arrival time, but taking a shower with your CHG soap before surgery is very important for preventing infections. Only take the medications that you were instructed to take by PAT and only with a small sip of water. Do not bring valuables to the hospital with you. Do not bring any of your home medications. We will have those here for you. And do not wear makeup, fingernail polish, toenail polish, your contacts, or jewelry. When you arrive to the hospital the day of surgery, you can park in parking garage H. You will see that the H garage is outlined with the red arrow below. Please note that the hospital map is located in the back of your patient guidebook. We are currently not offering valet services, but if you need assistance, your family, friend, or loved one can drop you off at the entrance to the hospital. When you arrive to the hospital on the day of surgery, you will start your day in the registration office. Registration is located on the first floor. After registration, you will go to the pre-op area. In the pre-op area, they will remove your glasses, hearing aid, and dentures. Please make sure that you bring a case that is labeled or a bag that is labeled for the items above. While you're in pre-op, you'll get your antibiotics through your IV, and you will start the anesthesia process. We will also give you your 3M nasal antiseptic to help prevent infections. Please note, at this time, we are only allowing one family or friend in the hospital with each of our patients. When you have done all the things that you need to do in the pre-op area, your operating room nurse will come and escort you to the operating room. This is where your surgeon will do your procedure. After the operating room, you will be taken into the recovery room. This is where a nurse will be closely monitoring you while you recover from your anesthesia. After the recovery room, you will be taken to the Joint Replacement Center. Please note, immediately after surgery, the surgeon will come and talk to your family or friend in the family waiting area. After the surgeon talks with your family or friend will be asked to leave the campus due to the current visitor restrictions related to COVID-19. When you arrive to the Joint Replacement Center, this is where you will start meeting your joint team. Your joint team consists of multiple people at the hospital. This includes your surgeon, your nurses, your nurse techs, occupational therapy, physical therapy, case management, and sometimes even a hospitalist. We want you to know that all of these people are working together to make sure that you get the best care possible. Now let's talk about ice therapy that you will receive while you are in the hospital. Ice therapy helps decrease pain. Anytime that you are having pain, you need to put ice on the site that hurts. Please ask your nursing team for an ice pack if you don't already have one. We will provide all of our patients who are receiving a knee replacement with the ice wrap pictured to the right of the screen. All of our patients who are receiving a hip replacement will receive an ice pack as pictured on the left of the screen. Staying active after surgery. We will provide you with an incentive spirometer. An incentive spirometer is the device that is pictured on this slide. After surgery that involves anesthesia, it is good to exercise your lungs in order to prevent pneumonia and other residual fluids that may be in your lungs. The benefits of using your incentive spirometer are that they gently exercise the lungs to keep them as healthy as possible. They also increase lung capacity and improve patients' ability to breathe. Make sure that you continue to use this while you're at home for up to 2 weeks after surgery. The nursing staff on the Joint Replacement Center will show you how to use this device. It is important that you use this 10 times an hour while you are awake. Please don't be afraid to ask our staff for clear instructions if you're not sure how to use this. Falls after a joint replacement surgery are a really big deal, so we do several things in the hospital to prevent falls. You will be given a gait belt that you will wear every time a staff member gets you out of bed. This gait belt will help a staff member stabilize you if you start to fall. We also use bed and chair alarms in the hospital. We do not want you to get up without help, so make sure that you keep your call light close and call before you fall. Anytime you need assistance, please hit your call button and we will send a staff member to your room to help you get the things that you need. Never get up without a staff member present in your room. Now let's talk about your daily walking goals. All of our patients are discharged home encouraged to use their walker. If you currently have a walker at home, please make sure that your walker has wheels. If your walker does not have wheels, you can buy wheels at the pharmacy here at UT Medical Center or at other local pharmacies. But it's important for your mobility that the walker you use after surgery has wheels. If you do not have a walker with wheels, we are able to provide you with a walker before you're discharged. Part of your walking goals and your mobility is your weight-bearing status after surgery. Most patients are able to bear as much weight as they are able to tolerate. What that means is that there are no restrictions that your surgeon has put on you as far as how much weight you can put on your operative leg, but we do not want you to cause yourself an extreme amount of pain, so we say you can put as much weight as you're comfortable. Your walking pattern after surgery is going to look a little bit different than it did before surgery. If you remember, we said that you're going to be discharging with a walker. So your walking pattern after surgery will be walker, surgical leg, non-surgical leg, walker, surgical leg, non-surgical leg. And you will hear that a lot as your physical therapist walks with you after surgery. Our goal is that you are able to walk 200 feet on the day of discharge. Let's talk just a little bit more about the walker that you use when you are at home. If you need a walker, we can give you a walker when you're discharging from the hospital if you are going home. If you're going to a skilled nursing facility, you will get a walker from the skilled nursing facility. If you have a walker at home, we encourage you to bring it with you to the hospital. Please note, your insurance company may cover a portion of your walker if you haven't received one in the last 5 years. Pain control after joint replacement surgery is really important. The picture below, you will see the ruler that we use in the hospital that rates your pain on a 0 to 10 scale. It's important for you to understand that you will have pain after your surgery, and everyone's pain is just a little bit different. While we do try to use things that are effective for most patients, it's important for you to communicate with us if the pain medication that we're giving you is not working, or if it's too much and making you too sleepy. Now remember, one of the most important things that you can do for your pain is move. Motion is lotion. Pain is a part of the process, and unfortunately it is part of your healing. Make sure that you're communicating with your team if you feel like that your pain is not controlled. Most pain medication is ordered every 4 hours or as needed while you are in the hospital. You will need to call out and request for your pain medication. Make sure that you talk to your nurse about your pain management whenever you come to the Joint Replacement Center. Now let's talk about some things that you can do to prevent the risk of complications of surgery. One of the main complications that we see after surgery is constipation. Constipation can be caused by a wide variety of things. You're not up and moving like you normally would. Sometimes you can be a little bit dehydrated. Anesthesia tends to slow things down, including your bowels, that can make you a little bit constipated. We recommend that you take stool softeners, which will help soften your stool. Stool softeners are found over the counter in your local pharmacy, and they are often called Colace or Miralax. We also recommend that you take a laxative. A laxative helps push stool through your bowel. Laxatives include things like senna or magnesium citrate. Blood clots are another complication that we can sometimes see after joint replacement surgery. Things that we can do to help prevent blood clots are TED hose. You will see TED hose on your legs whenever you wake up from surgery. We also use compression devices, as you will see in the picture beside the slide. We also encourage you to move. The more you move, it keeps your blood flowing. We also encourage you to do the ankle pumps that are the exercises in your book. This will help keep blood flowing through your legs. And then all of our patients will be leaving the hospital on a blood thinner. Discharging from the hospital. The day after surgery, we will discharge you as soon as you are able to pass physical therapy and you are medically stable. Most patients are able to discharge from the hospital the day after surgery and often leave even before lunch. Upon discharge, you will be taken down in a wheelchair to the fountain circle. That is where your family or friend who is taking you home will meet you. We would like for you to know that we have an outpatient pharmacy here on campus. Our outpatient pharmacy is located across from the cafeteria. If you would like to have your prescriptions filled here, please tell your nurse. Your nurse can fax down your prescriptions and you can pick them up on your way out. Please note, if you are from a different state, you will likely not be able to get your pain medication prescriptions filled in your home state. Pain medication prescriptions must be filled in the state that they were written in. I would like for you to be aware of some pain medication laws that are a little bit unique to the state of Tennessee. The state of Tennessee has very restrictive laws that your surgeon must abide by when prescribing pain medication. These laws restrict how much pain medication your surgeon can prescribe and also the strength of pain medication that your surgeon can prescribe. Please discuss with your surgeon if you have any questions regarding your pain medication. Another prescription that you will need is a physical therapy prescription. If you are going to outpatient physical therapy, be sure that you have a prescription for your therapy before you leave the hospital. You will need to take this prescription to your first therapy appointment. This prescription is needed in order to bill your insurance. Now I would like to talk to you about your toolbox for pain management. We use different things to help manage your pain. Some of the most common things that you will see are narcotics or pain pills like oxycodone, tramadol, hydrocodone, Dilaudid, or Nucynta. Sometimes we also prescribe nerve pain medication like Lyrica or gabapentin. Nausea medication like Zofran, Phenergan, or Vistaril, but I would like for you to know that there are other ways that you can control your pain. This would include ice therapy and Tylenol. We do, however, ask that you do not take any anti-inflammatories until your surgeon instructs you to take those. Anti-inflammatories include things like Motrin and ibuprofen. Now we would like to talk about your pain medication prescriptions. Take your pain medication as prescribed but only as needed. An example is take every 6 hours as needed. This means to take your pain medication when you are hurting but no sooner than the hour written on your prescription. What can you do for breakthrough pain? An example, if you take a pain pill at 8 a.m. and can't take another one till 2 p.m. but you start to hurt during that time, this is called breakthrough pain. Some ways that you can manage your breakthrough pain are ice therapy, Tylenol, and some physicians will write orders for medications for you to take for this breakthrough pain like tramadol or Vistaril. We would like to encourage you to stay ahead of your pain. If you rate your pain a 4 through a 6, then it's probably time for you to take something before your pain gets out of control. You do not have to set an alarm to wake yourself up in the middle of the night to take pain medication. If you are sleeping, then your pain is likely under control. When is it time to start weaning your pain medication? If your pain is a 1 through a 3, then it's likely time for you to start weaning your pain medication or your narcotics. Some ways that you can do that are starting to spread the time out between taking pain pills, cutting your pain pills in half, start replacing pain pills with Tylenol. We do not encourage you to stop taking your pain pills cold turkey, meaning stopping them completely, and we also encourage you to use ice therapy. What are some ways that you can optimize your recovery at home? The first and most important thing that you can do is make sure that you're getting plenty of rest. We also encourage you to be active while you're awake. Make sure you go on walks and continue to do your daily exercises. It's equally as important that you eat a healthy diet, leafy green vegetables, fruits, proteins, and make sure that you're drinking 8-ounce glasses of water a day unless you're on a fluid restriction. Some of the things or questions that we usually hear after surgery is sometimes patients feel a little bit depressed, meaning that they're sad or they're just not feeling like themselves, and that can be common after surgery. Make sure that you have visitors or family to talk to, and if this continues and you're concerned, talk to your primary care doctor about this. Another question that we get after surgery is, how long is my recovery? And the length of recovery is different for everyone. It can take 6 months up to a year before you are fully recovered after a joint replacement surgery. Follow up with your surgeon after surgery is very important. Most surgeons like to follow up with their patients at 2 weeks, 6 weeks, 3 months, and 6 months. At the 2-week appointment, they will be checking to make sure your incision looks good and that your staples are removed. After the 2-week follow-up, the 6-week, the 3-month, and the 6-month appointment are equally as important to keep because your surgeon is just going to be making sure that you're recovering well. Now I would like to talk to you about some changes that we have had to make to our program and to our hospital related to COVID-19 or coronavirus. Whenever you enter our campus, when you come in through the door, we have checkpoints. At this checkpoint, you can expect that someone will be assessing you to see if you have traveled within the last 2 weeks, and they will also be taking your temperature. This is the checkpoint where they will also verify that you have one visitor with you. You may also notice that most of our staff will be in masks while you're here. This is for the protection of our patients and also for our team members. We are also enforcing a no visitation policy right now. What that means for you and your family is that you will only be able to have one person with you while you are going through your surgery. After your surgery, your surgeon will come out and speak to that one person that will be in the surgery waiting lounge. After the surgeon speaks with that one person, they will be asked to leave the campus. They will not be allowed back onto campus until you are discharged. We also encourage that if you live far away that you look into local hotels for your friend or family to stay the night so that they are able to come and get you the next day after surgery. Our goal at the University of Tennessee Medical Center is to always deliver excellent service at every step of your total joint replacement journey. We want your experience to be nothing but the best. You may receive a survey in the mail after your hospital stay. Our goal is that you are able to rate your experience with us a 9 or a 10. Now, if you feel like at any point during your journey with us that we haven't quite met the mark, please reach out and let us know. Our goal first would be to recover, and then second, to make sure that we are able to correct any problems or difficulties that you may experience. Again, we don't anticipate anything but the best, but please let us know if there's something that we can do for you. Lastly, we would just like to thank you. Thank you for choosing the University of Tennessee Medical Center. We know that you could choose any other hospital in Knoxville, but we thank you for choosing us. Our hope is that you would be able to recommend us to your family and friends. I want you to know that we are here for you. Although we are typically able to provide this joint replacement class in person, due to our circumstances right now, we are not able to gather together. But we want you to know that we still have resources here for you. So if you've listened to this presentation and you have any questions, please do not hesitate to give our patient navigator a phone call. We're happy to help navigate you through the process of your total joint replacement. You can reach us at 865-305-3270. Thank you.